my name is Brittany. I'm a student PTA here at IoT. Today with me we have Katie. Katie is a runner and she's recently increased her running distance from 2 to 3 miles and has been having complaints of left distal calf pain and was diagnosed with Achilles tendonitis. Achilles tendonitis is basically an overuse syndrome of the tendon that connects your distal calf to your calcaneus just under your foot. Let's see. That would be your tendon right there. Achilles tendonitis usually looks like stiffness, dull aching pain, and is typically seen in runners. So we are going to go ahead, we're going to do some treatments today. Is that all right with you? Mm-hmm. All right, let's get started. All right, right now we're going to go ahead, we're going to do a wet foot test. If you can go ahead and stand up for me, Katie. And then go ahead and step off for me. All right, and this is going to go ahead and give us a visual of like where she's weight bearing, and you can tell that she is overpronating on her left foot. So that's going to help guide our treatment today. Okay, you can go ahead and have a seat now, Katie. All right, so we're back, and we just did Katie's wet foot test, and it did show that she does overpronate on her left foot just a little bit more. And that can be leading to some of her Achilles pain. It could be putting some sort of a valgus stress while she's running on the Achilles tendon. So some things we can do to help that would be, number one, looking at the footwear that she wears and looking at the tread that's on the bottom of the shoes. We can also suggest a insert for the shoe that has a high medial arch to keep her foot from overpronating while she is running. Or we could even suggest a small heel lift. We don't want to offset her leg length, but it does take a little bit of stress out of the Achilles. Now that we've talked about overpronating, we're going to go ahead and we're going to move into our treatment portion. Okay, all right. All right, we're back. We're going to go ahead. We're going to start our first treatment. The first thing we're going to do is some instrument-assisted soft tissue mobilization. The science behind this is that this can break up any scar tissue, adhesions. It promotes blood flow, lymph flow, improves circulation, which is all going to help her healing process and be able to get back to running sooner. And there is recent research right now that is saying soft tissue mobilization, instrument assisted, can shorten the recovery time needed for an injury. So we're going to go in with this rounded edge right here, and we're going to go down. And when we're doing this, it's not too hard because right now we're just doing an evaluation, seeing if we're feeling any knots, any crepitus, anything like that in her muscles. While you're going this way, we're going to go ahead and we're going to switch ways. We want this at about a 20 to 30 degree angle, going up the calf muscle. After that, we're going to go down on the tendon, and you want to be just a little bit careful because with Achilles tendonitis, it could be currently inflamed and painful. So we're going to go over this tendon. Are you feeling all right, Katie?
It's okay.
It's okay? No pain?
No.
All right. We're still on that groove. But next we're going to switch to this rounded edge, and we're going to go on the sides of the Achilles. This is also going to help break up any of those adhesions in this area, making it easier for the healing process to begin. I mean, you can also go down here just under the calcaneus where the tendon attaches, as long as they're not ticklish. If they're ticklish, I probably would just skip this step. All right. We're going to move on to the next treatment. All right, we're back. We're going to do our next treatment. We're going to go ahead and we're going to do some cupping. The scientific research behind cupping is basically it aids in decompression. So if she's having any of that stiff, tightness, adhesions, this can help break that up along with the scraping. And the relevant research and studies right now suggest that this may improve blood flow alone than just scraping itself. So we're going to go ahead and we're going to apply this to her distal calf, the sides of her tendons, and where the tendon attaches at the calcaneus. And unlike regular cupping where you put it on and they stay static for a couple minutes, we're going to use some active range of motion by putting this on the tendon sites and have her do some ankle pumps and then pop them off. This is going to help stretch and lengthen the tendons and provide more range of motion. All right, so let's get started. All right, Katie, I'm just going to go ahead. I'm going to put some cups on you. Is that all right?
Okay.
All right, you go ahead and let me know if you have any pain. And with this, I still have some emollient on her from the scraping. I did 2 pumps. Can you go ahead and do an ankle pump for me? And do one more. All right, we're going to pop that off. We're gonna move locations and we're gonna go to the side of the tendon. I'm only doing one pump here. Go ahead and do some ankle pumps. And we're just checking her pain level. Is this painful at all?
It's okay.
It's okay? Awesome. And you can already see the increased blood flow to the area. Go ahead and do some ankle pumps. We're gonna do one more at the bottom of her heel. Go ahead and do some ankle pumps. All right, and just some quick contraindications. I definitely want to be doing cupping or the soft tissue mobilization over anybody who had like some unstable fractures or circulatory issues or even diabetes, since we're working on the lower limbs. Just make sure that all those boxes aren't checked before you do these. All right, we are back and we're gonna do our final treatment. We are gonna go ahead and we are going to use some KT tape here on Katie's ankle. The science behind KT tape is that it is decompressive. It pulls the muscles away a little bit and opens up that fascia, brings some blood flow and stuff to the area. Once again, helping her healing process. That way she can get back to running sooner. And there is recent studies that suggest if you apply KT tape to the lower extremities, that it will help with ankle proprioception while running. So if she is having a problem with overpronating while running, this can definitely help. So I went ahead and I made sure to clean off that emollient off of her leg that we used for the cupping and the scraping with some alcohol, because if you leave that on, the tape will not stick. I went ahead and I rounded the edges of my tape. I have one small piece here. I have one big long piece. And we're gonna go ahead and we're gonna apply these, but before we do that, we wanna make sure that we find a good subtalar neutral for her foot, especially if she is overpronating. So with this long piece, I'm gonna go ahead and I'm gonna rip the edges. These are gonna be for your anchor strips. With your anchor strips, you want no tension at all. And we're gonna apply the first anchor strip right where the Achilles tendon attaches to the bottom of the calcaneus here. So we're gonna take this piece off. We're gonna apply this here. You're gonna peel this up, this backing up, and you're gonna apply it with 25% tension. Up to about mid-calf. Once you're here, you're gonna take off your anchor strip. That should have no tension. You're gonna go ahead and you're gonna lay that anchor strip down. And you're gonna go ahead and use a pinching effect to get this down and around the calf. And this stuff is heat activated, the glue on it. So you wanna go ahead and you wanna rub the edges, use a little bit of friction to make sure that that glue is activated. How does that feel, Katie? Any pain with this?
Feels okay.
All right, awesome. All right, and so now we're going to use this little piece. This little piece is called our decompression strip, which is really going to help pull that Achilles away, open up the fascia, and bring some more blood flow. Unlike this one and doing the edges, you're going to do one rip right down the middle. And this strip is going to have 50% tension. So you're going to peel these back. And you're going to go ahead and pull it to 50% tension. You're going to apply that right over the sore part. And then release your anchor strips, which should have no tension at all. Go ahead and give it a rub. And you definitely wouldn't do this for somebody who, once again, has circulatory issues or has allergic to certain adhesives. And I would go ahead, Katie, we can wear this tape for about 48 to 72 hours as long as it doesn't bother you. And I would take it off in the shower just because that water is going to help lift it from the skin a little bit better.
Okay.
All right. All right, so we went ahead, we did some cupping, we did some scraping or instrument assisted soft tissue mobilization, and then we finished up with some taping here. We're going to go ahead, we're going to let Katie see how that feels, and we'll see her again on her next appointment.